What happens now? You'll get over heartache. You'll get over heartache. You'll get over heartache.
Good evening, St. Lucia. Thank you for joining us for another episode of What's Happening Now with Laura. Before we get into the substantive part of this evening's program, I want to make a special appeal to fellow St. Lucians. I know that we're in a heightened state of uncertainty right now. And I know some of us are trying as best as possible to remain healthy, to combat this new scourge which is facing our land. But for goodness sake, if you're going to go out at night for a walk to boost your spirits, to stay fit and to keep healthy, do so responsibly. This evening, on my way to the studio, I came across a number of walkers. And unfortunately, I saw some of these walkers mere seconds before my headlights flash on them. And I'm saying to myself, my goodness, why would you go out walking in a dimly lit area in dark clothing? That makes absolutely no sense to me. Around a bend, in a dark or a dimly lit area in dark clothing, is it a case of you're gonna get out of this world before COVID-19 gets to you? I mean, seriously, people, we have to think beyond just ourselves. We have to think that our roadways are primarily used not by pedestrians, but by motorists. Furthermore, in a situation where we're talking about isolation, staying at home, not being out in the public, I understand the need to keep fit, to keep healthy, to go out there. Sometimes working out clears your mind and you see things in a better light, and you just feel better about yourself. And I understand the need for that. But if you're going to do it, do so responsibly. Do so wearing neon colors, fluorescent colors, something that from the time lights are approaching, the motorists can see you. You never know who is sitting behind the wheel. Some of us ought not to be behind the wheel, but unfortunately, we are. And I say we because I'm a motorist. Some of us are not supposed to be behind the wheel at all, but we are. And you, the unsuspecting pedestrian, being careless and negligent with your earphones on, your head down, you don't even see the lights coming towards you in dark clothing. This is a recipe for disaster. So I'm pleading with us St. Lucians, please be a little bit mindful when we're going out. Be a little bit mindful of others. Yes, some of us like to wear dark clothing because we feel it minimizes our girth. But you know what? Ain't going nowhere. It is there. So unless you lose weight, you're still going to be a big person. I can attest to that. But if I'm going walking, I certainly am not going to be wearing dark clothing because I will appear slimmer than I really am. At the end of the day, what is the main purpose of going out? Walking. Is it to look good or to get good? Let's just bear that in mind. So that was my little rant. On to other matters now. The outbreak of the coronavirus has been labeled a pandemic by the World Health Organization, WHO. Countries around the world are increasingly adopting sweeping measures to stem the spread of the new coronavirus, including shutting down the airports, imposing travel restrictions, and completely sealing their borders in some cases. But is that enough? Tonight, Dr. Merle Clark, president of the St. Lucia Medical and Dental Association, will be my special guest. And we are going to discuss how to inoculate ourselves from the fake news that is wildly and irresponsibly being spread, needlessly diverting us from the cause. The cause being to flatten the curve in record time in order to minimize the health and economic fallout of the coronavirus and its deadly offspring, COVID-19. But first, what's trending? So, in St. Lucia, we've had daring escapes. Daring escapes. Over the weekend, we were greeted with news of 6 inmates who escaped from the Bodley Correctional Facility on Saturday around 6 p.m. Now, I use the term correctional facility very loosely, and a little later on, I'll explain why. 4 of the prisoners were caught shortly after they escaped. They were reportedly caught in the vicinity of the prison. Dave Joseph, one of the escapees, has also been captured. He was one of 2 who had evaded capture for a little while. And we may remember Dave Joseph as the individual accused of killing Brandon Breedy. Remember Brandon? And the attempted murder of 2 other people. And who also, this is the same Dave Joseph who spat at journalist Miguel Fevrier on his way to court in 2015. 18-year-old Brandon Breedy of Hospital Road was asleep in his bed when he was shot. His body was discovered by relatives on a mattress full of blood. He received 3 gunshots to the head and chest. That is the Dave Joseph that we're talking about. This is the notorious Dave Joseph, but he's been caught and he's been returned to prison. However, Marquis, also known as Roadblock, who is also reportedly a suspect in a murder case, however, still eludes capture. Marquis, on remand at the Baudelaire Correctional Facility after being charged for causing the death of Lyndon George in Bruceville. And you would remember Lyndon George, and that was last year in December, I believe, if memory serves me correctly. Now, we'll remember Lyndon George was a DJ by profession. He was a young DJ, and he was the DJ in the DJ booth at a session in Bruceville on, I think, the 2nd of December at about 2 a.m. when he was shot once in the head, execution style. So this person, Marquis, is still at large, and he escaped lawful custody after assaulting a correctional officer. He's considered armed and dangerous, and the public is advised not to engage him, but to contact the nearest police station should in case you see him in your neighborhood. And I think that's something that we all need to be on the ball and prepared for. If we see this person, we need to get in touch with the police ASAP, because he is considered armed and dangerous, and anybody who could shoot somebody in the head, execution style. This is like the stuff assassin movies are made of, and you don't want to be an additional victim of to this person. So please contact the nearest police station and do the right thing. Do not approach this person. Now, this isn't our first prison break at the Bodley Correctional Facility. In 2016, Hanson, some of you will remember Hanson, Dirty White James, jumped over the barbed wire fence of the prison and escaped through heavily snake-infested bushes, but was captured by law enforcement a few days later. And also in August of 2010, 2 Venezuelan nationals and 1 St. Lucian escaped the prison, but were never caught. So this is not the first time that an inmate has escaped lawful custody, and we won't talk about all of the hundreds of escaped prisoners from Her Majesty prisons in the old prison in downtown Castries. So be on the lookout for Marquis. Still on the topic of escapees, and this one has my goat. At least 2 individuals who arrived here on Friday from Martinique who were immediately put in quarantine out of concern that they may have contracted the COVID-19, escaped from the facility where they were being kept. Now, there has been a viral video of a young man jumping a fence of what was identified as the Starfish Hotel in the north of the island, which is serving as a quarantine site, posted all over social media. I alone must have gotten it about a dozen times. Confirmation came from the National Security Minister, Honorable Herman Francis, who said he believed about 2 persons had fled. 93 persons were brought home from Martinique. Now, this is the background I want you to remember. I want you to keep in your mind when you're thinking of the 2 persons who escaped the quarantine. 93 persons were brought home from Martinique after Martinique had closed its doors. So Martinique had said, nope, nobody's leaving, nobody's coming in. We're closed, we've closed our borders, we've closed our doors, we're not accepting anybody. We pleaded with them to release into our custody our nationals who wanted to come back home. Upon discovering that they would be quarantined for 14 days, 45 persons chose to remain in Martinique. 45 determined that they wanted to stay put. But 93 persons agreed to the terms and came back home. Yet 2 chose to abscond. Now, tell me, does that make any sense? You knew what the situation was going to be before you left Martinique. You have friends and family in St. Lucia. You may have been exposed to COVID-19. Knowing all what you know about the decimation of nations by this virus, you're going to decide that the best thing that you want to do is to escape quarantine and go liming. Take a bus. You may be exposed. You may have contracted the disease. You don't know, because it takes a while before it shows up its ugly head. You go up all over the place. You contact your friends, your family, exposing them now to the virus, and you think that is the best thing ever. What are we thinking? And then you're going to tell me that there are people who are going to hide these people, who are going to abet these people? I mean, seriously? And we want to talk about preparedness. Here's the thing about preparedness. Every person, every individual, every citizen has to play their part. It's not just a government thing, or a doctor's thing, or a nurse's thing, or a healthcare professional thing. It is all our thing. We all have to play our part. So when you tell me you're coming in and you're absconding, I cannot blame the Prime Minister for saying, and the government for saying, anybody else who is outside, please stay outside. We're not bringing anybody in. Anybody who is taking a flight is taking a flight out of St. Lucia. In other words, we are going to repatriate, we're going to allow for the repatriation of persons who are in St. Lucia. So you belong to the United States, you want to go? Go away. You belong to the UK, you want to go home? Go home. But nobody is coming into our country. And I agree with that 100%. It could be my mother, it could be my father, it could be my sisters, it could be my brother, it could be my nieces or my nephew. No. Stay away, because you are doing us, your family, a disservice. If you come in, we already have a less than stellar healthcare system. We are already overworked, understaffed. We cannot afford. Please stay home. All you're doing is bringing in problems and fear and putting your families, your community, your St. Lucia at risk. Speaking of absconding and speaking of correctional facilities. So, earlier last week, I think it was, we heard of riots in the jail in Trinidad, and persons in Trinidad were the prisoners were complaining of the conditions there, and so they were rioting and burning things and whatever. Would you believe that this thing is infectious? Would you believe that right here at home, prisoners at the Bodley Correctional Facility, and I use that very loosely because that is not a correctional facility. Because if it were a correctional facility, more of those inmates would have been, would be in a better frame of mind to understand that if you're going to burn down the building which houses you, you better have an escape route. You better have the keys to the jail. You better know how you're going to come out of it, because if you burn yourself in a room, I personally am not going to put myself at risk to save you. I didn't burn you. It wasn't a case of poor electrical wiring. It wasn't a case of negligence on anybody's part. You're burning yourself down. You're either insane or you're trying to manipulate the system. So on Sunday, the prisoners decided they're going to riot following a lockdown at the facility because their colleagues decided to abscond from the prisons. Inmates lit mattresses on fire in retaliation for the lockdown, as I mentioned, because of the prison break, threatening to burn down the correctional facility or the prison, because I do not see much rehabilitation going on for you to tell me that this is your only course of action, to burn yourselves down. Because that's what you're doing. You're burning yourselves down. You're locked inside, they're locked outside, and you're burning yourself down because they escaped and because the authorities decided a lockdown. Doesn't make much sense, does it? Anyway, that's the emergency. Let's talk a little bit about the state of emergency that we are under right now. So our government has seen fit to institute a state of emergency, which gives our government extraordinary powers to enforce some of the laws, some of the restrictions that they have implemented that persons choose not to follow. Ideally, typically, I really don't have a problem with that. I would like not to have a problem with that. But in the back of my mind, I am mindful of the saying that absolute power corrupts absolutely. But I won't get into too much detail on that, because next week I want to delve into the economic fallout of this COVID-19 saga. Right now we're going to take a break, and when we come back, on the other side of the break, we'll be having a chat with my special guest, Dr. Merle Clark. Stay tuned.
Heartache. You'll get over heartache. You'll get over heartache. You'll get over heartache. You'll get over.
Welcome back, St. Lucia, and thank you for staying tuned to What's Happening Now with Laura. My special guest this evening is Dr. Merle Clark. She's the president of the St. Lucia Medical and Dental Association, and she's here this evening to talk to us about the dreaded contagion, COVID-19. Welcome, Dr. Clark.
Well, thank you, Laura.
Well, before we go into what you're here for, what did you think of, I mean, during the break we were talking about
The attempted prison break.
yes, the attempted prison break, and you were saying something very
Naive?
yeah.
Yes. I was having a discussion with my friend Alyssa on the weekend, and in my mind, it obviously was an attempt to manipulate the system. You know, everything is going on, so why not try and get out? So in my mind, I thought, if the prison is burning down, do you just have to let all the prisoners go? And she's like, are you crazy? Never does that happen, but you can't let them burn in there.
Yeah, but then you came up with you made a valid point. You said, is other authorities now going to be held liable if they die in there, and they're the ones burning themselves? But and I would have been tempted to say, no, because they didn't burn them down. It wasn't negligence on their part. But then it occurred to me, how come so many of the prisoners had access to fire?
Yeah.
How come so many of them had access to cell phones? Not just any regular Pell, you know, Merle.
Yes.
We're talking about...
Better than yours and mine.
Yes, man. Smartphones with the capability of taking
Yeah.
excellent videos and with the data to send it out.
yeah.
So it's not just taking the videos. You have the video, but you have data on your phone to be able to send it out.
Right.
What's up with that?
So maybe your next guest needs to be a human rights person, because it's interesting what should be allowed and what should not be allowed. Certainly they should not have fire. But should they have cell phones that you could communicate and be manipulating things from inside prison?
That's called...
That's a
that-
very interesting question.
I asked a police officer and a correctional facility correctional officer about that before. That's contraband. They're not supposed to have cell phones. You know, back in the day when we used to watch these old cop movies, and then you get arrested and you get that one phone call,
yes.
and then once a week you have this long line,
Yes.
and they've got to use their credits that their family
Yeah.
put on there for them, or through accumulating credits from working, doing various jobs around the prison
Right.
to make that phone call home or whatever. Yeah.
Everybody has a cell phone.
Everybody has a cell phone,
okay.
and it's not legal, because otherwise all of the correctional officers and the moms and the sisters and the brothers who were caught
Yes.
smuggling those things in, they wouldn't have been making such a big fuss about it. It's because it's contraband.
Absolutely.
So they shouldn't have them. And on top of that, they have credit.
Yes.
You know,
Many questions to be answered.
many questions to be answered. However, this is not what we hear.
Yes. So much to talk about.
So much to talk about with this contagion.
Yes.
I mean, let me tell you, it's scary. It's scary. Before we talk about anything else, I want us to deal with this video, and I hope we have this video queued up already. There's this video circulating of this young woman who's in obvious respiratory distress, like really, really bad, and she looks like she's having a really bad asthma attack. And I am an asthma sufferer, not very mild, but I know when I have had cases in the past, episodes in the past, I'm like, whoa, I cannot imagine what it's like to really have a serious case of it.
Right.
Because
If this is mild.
if this is mild, you know what I mean? Can you shed some light on that? Is that young lady, without divulging any patient information, is this young lady patient 3 as is being
No.
purported?
Absolutely not.
Did
I
she?
don't even think that's St. Lucia. I saw the video because, again, probably 10 people sent it last night. I don't even think that's St. Lucia, and that is certainly not patient 3.
Because they're saying that this young lady tested positive in New York. Tested positive. And here's where it started not making sense to me, because I had a family member who was adamant.
Right.
And I'm saying, maybe you're wrong.
Yes.
You know, like somebody can convince you that your name isn't
Yes.
Dr. Merle
I know-
Clark.
I know
You know
there
what I
are
mean?
people
They're
like
so
that, yes.
convincing. And then on top of it, there was this the voice note, and I'm like, oh my gosh, this person sounds so convincing, so knowledgeable.
Yes.
You know, some people just have this gravitas voice,
Absolutely.
and I started getting scared.
Because the implications are very serious. If what is being said happened, the implications are serious. So when I started getting it, and I got both the voice note and the video from multiple people last night, we did forward it, and the ministry apparently had received it. And there are investigations going on, but for every patient, because this patient was tested here and tested positive, I mean, her swab was sent to CAFA and came back positive.
The person in the video.
Not the person in the video.
Oh.
That person in the video is not patient 3.
So that person is not even on the record.
No,
and has not presented
I don't know
itself.
who that is. Let's put it this way, Laura. That video I saw on Facebook some time ago, days ago.
Right.
I saw somebody post that they got that video from French Guiana. So that video is making the rounds of social media, and I guess that is even a St. Lucian patient. The why of that, and of course, Laura, I do a show, and interesting enough, just last week, we had our psychiatrist, Dr. Gillard, on. And of course, what we were trying to delve into is the psychology of and taking care of our mental health during a time like this, time of a pandemic, but somebody in quarantine, 14 days, it can't be easy. What goes through your mind? How do you take care of the children, the elderly, people with chronic diseases, and all of that? And I tried to ask the question, we ran out of time, but what makes people do these things? What would make the person who sent the voice note? Because you have to know what the effect of that would be on the average St. Lucian listening to it. You have to know what the effect of sharing a video saying, this is what patient 3 looks like on the average St. Lucian. So the question is, why are you doing it? Is it simply malice? Is it mental illness? Is it some degree of... And we never got to delve into that too much, but it's really unfortunate that
For
these things
me,
happen.
I say this as someone who's suffering from some variant form of Munchausen syndrome. No, this is how I say it. Because, you know, they need to feel, they make you ill so that you're dependent on them.
Yes.
So there's some macabre,
Yes. It's not normal.
gruesome fascination with scaring people,
Yes.
and it's not good. It's not good. It's not healthy
Yeah.
for the person who's doing it, and it's not healthy for the
the rest
people,
of us.
the persons whom it has been inflicted upon. I have a sister with a young baby. Well, she's 3 years old.
Right.
And yesterday, for the first time, I saw abject terror in her eyes. My family, we operate a grocery store. She's managing the store.
Nice.
So on evenings, she works, like we all chip in and we work the store. And I saw abject terror in her eyes, and she was saying, oh my gosh, I could never forgive myself. Because after having viewed that video, she's like, I could never forgive myself if I brought this home to my
Right,
baby.
Absolutely. Absolutely.
And I think more parents, especially young parents, need to be cognizant of that. While you're out there not following the social distancing, and I know that is a new word in our
Yes,
lexicon right
yes.
now, and you know we're throwing
the
it.
phrase.
Oh yes, we're throwing it about like it's
Absolutely.
nothing. You know, whoa. I mean, I do it too because you know
Yes.
you want there should be some level of levity. You want to break
Absolutely. Otherwise,
the fear. You're right, because you could go cuckoo. Like, I mean, I'm saying that and I'm seeing Bugs Bunny in my head and Daffy Duck just going
Yes.
wild crazy, because sometimes if you think about it long enough, this is what it is. This is, you feel like you're ready to implode.
Yeah.
Why would you do that? And those of us who are going out there, and I've noticed a young people hugging and kissing, and I'm like, yes, this is your friend and you wanna, but this is not,
But-
this 2 weeks that we've been given is not a respite from work or respite from school to be silly.
no. It's
This
not.
is the time for us to be more introspective and for us to, and they're out there, and there are parents, sad to say, are out there in the bars, they're not at home with their kids, ensuring that the kids are safe and don't all I mean, like, what are you thinking?
I don't know. I think we don't get it. Now, is that a failure on the part of us, the healthcare providers? Because you're trying not to scare people, and you do not want St. Lucians to panic. You want us to understand the importance of this. I think the news does enough to scare and cause panic. If you look at CNN all day or any of those American news stations, the 24-hour news networks, it is scary. I think we all hear what happened in China. We all are aware of what's going on in Italy and even in New York now, even closer to home. So that in and of itself is scary enough. What we want St. Lucians to understand, we need to take this seriously. And on that note, the St. Lucia Medical and Dental Association is absolutely in support of the shutdown of our borders and of the state of emergency. Now, do we all know what all the implications of that are? No. We have to be vigilant. And again, these aren't things that are extended. But what we do know, we the members of the SLMDA, is what we have to work with. And we have to understand that we need to get ahead of this. We need to, we're seeing what has happened. We've had some time. So we, in a sense, you see how quickly this virus is moving. And the head of the WHO, in a press conference yesterday or the day before, he was just given some data in terms of where we were at in December when the whole thing started in China. To get to the first 100,000 cases, positive confirmed cases of COVID-19, it took 60-something days. The second 100,000 took 11 days. The third 100,000, to get to 300,000, it took 4 days. So it's moving faster. Instead of slowing down for now, it seems to be moving faster.
We have a graphic that shows, that depicts a little bit about what you're saying. Let's cue it up while we'll continue
Yes.
talking, but we'll pull that up.
Right.
We have a graphic. So if the producer can pull up the graphic, that'd be awesome.
Right.
And that will show you, give an idea as to what, and it's not even from December, it's from March 1st.
Exactly.
Up until the 22nd,
Exactly.
and how fast this thing has moved. And you can see the progression of different countries. And we're lucky, and I use that in
Yes.
inverted commas,
Yes.
we're lucky in St. Lucia that we only have three
Three so
confirmed
far.
cases, and those were imported cases.
Yes.
I wonder, at the end of the 2-week respite, what happens?
Yes.
Because if anybody has it, at the end of the 2 weeks, that's when it's really
Should
going
be
to
able
be
yes,
manifesting
exactly.
itself, right?
And that is the importance of this 2 weeks, in case St. Lucians don't get it. St. Lucia, we need you to understand. The 2 weeks, as Laura was saying, is not about going out and going to the bars and still going to parties and pretending I do not care about this. The 2 weeks are about, let's see what we have, because we are not testing everybody. And that is important to note. We should have started testing this week. That being said, even prior to this week, CAFA was only allowing per country per week about 20, because everybody is sending in a barrage of tests. So it's impossible. And this is not a situation unique to St. Lucia. We are in multiple, of course, as physicians, this is happening around the world. We all have to be talking to each other. Every physician is frustrated with the lack of testing in every country. No matter whether it's first world, no matter it's developing countries, there is frustration with regards to that. Because unless you have confirmation, you can't say, which is why in St. Lucia so far we have no proof of community spread. And just so we explain what community spread is, community spread as opposed to imported cases. The imported case is somebody who got it somewhere else and came into the country. So patient 3, as we said, patient 3 is a national, but patient 3 was not infected here. So the person who is with community spread, what you have is somebody who would have been infected here in St. Lucia. There is so far no evidence of that. Contact tracing is, however, a complex thing. And we want St. Lucians to understand that. And I had a graphic as well. I don't think we brought that one in terms of how complex contact tracing could be. Because, Laura, when we look at when somebody tests positive, we absolutely have to find all your contacts. So in medicine, where before did we talk a lot about contact tracing? In sexually transmitted infections. So let's say hypothetically, just to go a little off the tangent here, somebody tests positive for HIV. There's a department, the people who work with the sexually transmitted infection, the reproductive health physicians, they have to do the contact tracing, protecting people's privacy and all of that, but these are public health issues. But that is fairly easy, because what do I ask you, Laura? Who were you with?
Exactly.
And hope Laura is honest.
And hope that I haven't been with
a million people.
you
And
know?
you can find those people. What is the difference with contact tracing here with COVID? And the other issue is, if somebody is highly suspicious, you start their contact tracing immediately. But say Laura is patient X. Laura goes to the bar. Laura goes to the supermarket. Laura goes to work. Laura goes multiple places. After 3 days, or 5 days or so, Laura starts manifesting symptoms. Laura is tested and she's positive. Now we have to start tracing everybody who Laura potentially came into contact with. it becomes virtually impossible because, okay, let's say Laura went to church. We know who Laura sat next to, maybe, perhaps, next to in the church. We may be able to find who Laura sat next to in the bus because, of course, with the social distancing, you keep hearing 6 feet or 1.5 meters. Sometimes it's easy to find those people. But Laura went to the supermarket. Laura and I feel already. I'm walking around. I touch a kind of milk. I touch of this. I touch of that. There is no way to know who came after Laura.
And it's funny.
Took that kind of milk.
Exactly. And it's funny because we are a nation. We like to touch when
We
we're
like
talking.
to
Oh my
touch.
God,
Yeah,
we're laughing,
yes.
we're touching.
Absolutely.
Who knows? And one of the things I've noticed in the supermarkets, nobody really practices social distancing. So they're right up against your
Yes,
butt.
yes.
Like you go to the bank, have you know,
Yes.
you go to the bank and you're doing private matters and somebody's right up, despite the fact that there's a line.
At the ATM, at the ATM.
Yeah, and they're right up against you. And that, to my mind, has not ceased. That hasn't...
This week,
not
admittedly,
enough persons
not
are
enough.
doing it. Yeah.
Admittedly, this week I've been mostly here and there, and of course we're moving over to OKU, so there's a lot of work going on in that regard. So I have not been in a supermarket or a bank, certainly. I'm hoping, against hope, that St. Lucia's are starting to get it, because we've said social distancing enough, or we think we're trying to say it enough, on social media, text messages, on TV, is there. We need to bombard St. Lucians with it, but we need to understand the importance of it. So going to the bank, because I got reports. So there are reports from Massey, and let's just say kudos to Massey. Massey really has taken so many steps. So Massey, for now, 7 to 8 in the morning, the elderly and the differently abled can go in. Also essential service providers. They made a point of calling all the associations. So us for SLMDA, we did receive a call. This is your time to go. So again, it allows for there not to be not only those essential service providers who are providing essential service, obviously, and don't always have the time to get to the supermarkets on time, but again, just to ensure that people are dispersed properly in the supermarket, and we have to commend that. So the people outside, though, those the rest of the general public coming in at 8 o'clock for the rest of the day, some places, it has been respected, the social distancing, based on what you're hearing. But in some places, people are still all up against each other. And we need to change that. I think we need to get solutions to understand the importance of not sticking up on each other at this time. This is not the time to do it, because that is how people are getting sick. So this disease, from the time it started, we said it was a droplet disease. And by droplets, what we mean? The droplets, when you cough or sneeze, so that was the importance. In the beginning, people would say, why are you talking so much about washing your hands? And why are you talking so much about covering your cough? The importance of that, you don't want this spreading. Because when you look microscopically, if you cough or sneeze and you don't do it properly into your sleeve or into a tissue and discard that properly into a closed bin, it does spread. This one, however, is very heavy in virus terms. So it tends to drop. So it will drop on the surfaces, it will drop on the floor, it will drop on the wall, wherever it is. The issue is there's so much unknown about it. How long does it last? So this drops, here I come and I go about my business. Nobody knows if I have COVID or not. And then somebody comes and they touch the surface. So if that person does not wash their hands after properly, and I think there are multiple PSAs on now as to how to wash our hands for 20 seconds, wash the back of our hands between the fingers. That is important. Ensure the children know as well.
Oh, yes, and the children know, because
The
my
children
3-year-old
do
niece
in the
tells me,
thing.
Auntie, you have
Yes.
to wash it well. In between, wash
Absolutely.
your thumb.
The children are going to save
yeah,
us.
Yeah,
The
yes,
children are going to save us.
absolutely.
So if that isn't done, then you touch your eyes, you touch eyewear glasses, for example. You inadvertently touching your face a lot of the time, and not even subconsciously you're doing it. So it is important that you get into the habit of washing your hands more. And we say with doctors and nurses, we've known it. We always do it. You wash your hands between patients, but now you have to be doing it that much more, because if you do not do it, what you're doing is introducing.
My hands feel like leather.
Yes.
Because,
Everybody's hands feel like leather.
So you kind of have to be walking with lotion, and it
Absolutely.
almost defeats the purpose, because you know the more you
Absolutely.
lotion your hands, then you're actually picking up germs
There you
because
go.
of the
There you
but it's
go.
wow,
But
it's really rough on the hands.
You have to do it. I mean, the rough hands, but we're alive. Alive with rough hands,
With
or
a-
dead with smooth hands.
Yeah.
I mean,
I'd rather be alive with rough hands, yeah.
So that's essentially why you need to wash your hands, because otherwise you're introducing the virus into your mouth, into your eyes. We're not sure how long it lasts. So there are different times it seems to last on different surfaces, but that is how it gets in. Yesterday, however, the WHO seems to be saying that perhaps it's airborne. And airborne makes it a little more dangerous because it's more easily transmissible. It was easy enough, and we know it's easy given how quickly it's been spreading. But that also could be a manifestation of how not our hygienic practices aren't what they should be, given how quickly this has spread around the world. But if it is indeed airborne, and again, there still is a lot being done to investigate, to find out how this virus behaves, to try and find a vaccine, which we won't get yet. There's still a lot being done, but it is important we prevent it. And that is why all those measures, as an SLMDA, we believe we have to be aggressive. We have to overreact. If there ever was a time to be dramatic and overreact, now is the time, because we simply cannot handle it. So some of the measures we have taken, they were criticized by some, but I mean, these decisions were not taken lightly.
Let's talk about the radical moves that you guys have taken. Let's talk about the tele-doctoring or the what's the
Telemedicine.
Telemedicine.
Yes.
Now, I must say, when I first heard it, I said, you know, I feel like a little bit like Jetsons up in here.
Yes.
You know what I mean? And I commend you guys for that. But how exactly does telemedicine work?
Okay. Telemedicine is actually not new at all. All of us to a certain extent do it, because Laura, how many times have you called me? Like my doctor and said, Doc, I have this. That's in and of itself.
And that was the first, that was the exact example that I used.
Yes.
How many times have I
to a certain
Doc,
extent,
my back is like, what's going on?
So you don't want to be doing it all the time, but there are times when it can work. It depends on the patient. And that is simply what we're trying to say. We need to distance. We cannot have the same people, we are saying, and there are people who say now we should stop saying that the elderly, diabetics, hypertensive are more vulnerable. But they are. Young people die, and that's what we want young people to understand.
And I want to pause here, because that's the argument that a lot of young people use. But I want to say Mozambique, but I think I'm saying the wrong country. But an African nation nonetheless, a 30-year-old died.
Nigeria, I think it was.
Is it Nigeria?
An uncle. I think I read that story.
And in the UK, an 18-year-old has passed from COVID-19. So it's not just
about old people,
vulnerable people,
not at all.
Old people, chronically ill people. Yes, they are more vulnerable, but young people
are dying as well. So you cannot take this lightly and ignore it and say, okay, granny is expendable, or, you know, your great-grandfather is expendable.
And the thing about it, young people also feel that they're invincible.
Yes.
Some of them, I'm not so young.
You're not a millennial, but you're young. The millennials.
You look for every little excuse not to remove yourself from the little boxes. I'm not so young anymore, so that's not me, because I ain't stupid. But seriously though, jokes aside, sometimes they're not even aware that they have underlying issues.
Absolutely. And that's a problem.
Some of the illnesses that they're ascribing to older people, they may have that latently and they just don't know it yet. And it takes COVID-19 to bring that to the fore.
And that's a very valid point. That's a very valid point. For the same reason, sometimes a young person would come in, they had a minor accident, and that's when you realize, okay, the blood pressures are sky high, but they have no pain, everything has resolved, and they're hypertensive. And that's when it's discovered. This is going to allow us to discover many new things, because people are going to come in for one thing or the other.
My partner says COVID-19 is going to show us how sloopshus. Our people are, some nations generally are, and it's going to also show us how clean the world will become afterwards, after this.
Yes. It's going to reveal a lot. I think it's going to bring out who people are. The best of us and the worst of us. It absolutely
and we are seeing that.
You're seeing that, because just with what you spoke about with the video, because let's just say hypothetically, this had been patient number 3. Why do you think it's okay to have her picture on social media and being shared via what? Why is that okay?
Exactly.
If this were your mother, your sister, would you want that to be to happen? No.
Where is the respect?
The humanity. We can't lose our humanity in this thing. Because even the idea that nurses now are being shunned and ostracized and move there, you're a nurse. These are the same people who have to take care of us.
And it's not just happening. And sadly, you know, I have a friend of mine, a classmate of mine who lives in Canada, and one of her colleagues had just gone to the supermarket, up to the deli to get something to eat. She was in between. They have no lunch hour now. They have no breaks, regular breaks, and she came back blooded because somebody at the store had knocked her out because she was in her scrubs and said to her, she's spreading the virus.
there is a lot to be said because that's a debate which has been had before. Should there be, but you understand in that situation, it's just rushing in. Because the question is, should you be in your scrubs or in your nursing uniform in town? And maybe your hospital should provide somewhere for you to change. It's not available, but all of that is bringing that out. And those are
All of
issues.
those gray areas.
Yes, have to be brought out. But the idea of you, when you read stories of nurses being spat at, and this isn't here, but in other places, but here they're being looked at
Oh, yes, they
suspiciously
are.
as well. Like,
People don't want to sit next to nurses on the
it
bus,
is
you know.
happening. Like,
It's
this
happening
is the
right here in
nurse
St.
who has
Lucia.
to take care of you. So we cannot lose our humanity. Somebody coughs now, and dear Jesus, get away from me.
You know, I was...
How
There
dare
was-
you cough?
Pretty soon, one of the more colorful citizens was saying how, you know, he wanted to sneeze. And he remembers all of the memes and everything, and he says that sneeze is going to choke him because nothing is
It's not
making him
coming out,
sneeze.
you know.
And then there was this other video of this guy on the bus operator telling people, you know, everybody when you sneeze and cough, everybody looks at you. So here's what to do should you develop the urge to sneeze or cough. Quickly swallow it and let it come out as a fart.
Oh,
you know,
a fart is forgivable nowadays, but a sneeze is not.
A sneeze is
And
not.
we
you
have
know?
to be careful,
And it's
but-
funny how, and people actually think that way. They actually believe that, and it's all a manifestation of not having enough information
Yes.
and giving into fear. And I
Yes.
say fear is going to kill people, not COVID-19.
It is true. But when my friends call and they say, where is this in St. Lucia and where is that and what is happening? Because we like to compare. In St. Lucia, what I've noted, everybody is comparing, oh, this place has closed its borders, that place. I'm like, why not OECS has closed their borders? To me, I don't know any island now. I think Dominica, they have community transmission, proven community transmission. So they have, but the comparing game is happening. And the truth is, if you allow it, it gets annoying. Which is why our mental health professionals are saying, you need to take a break sometimes.
Chill.
You cannot be all COVID-19, not CNN all the time, not social media. Take a break, read a book. The 2 weeks you're at home, use that time to do that, perhaps, if you're not supposed to be working. Because, of course, as an SLMDA, we have to stay home. If your work can be done from home, stay home.
And that's the
that
other
is our
thing.
message.
We have to clarify that a little bit. But going back to the telemedicine,
Medicine,
how
yes.
does it work for the doctor? So we know call ahead,
Yes.
you know, call and present your symptoms, and if the patient needs to be seen in person for further diagnosis, then you come in or whatever. But how does that work for you, the doctor, in terms of financially? How
Yes.
how does one pay for telemedicine? I don't
Right.
know what I mean. And please don't start charging me.
In more organized places, there are platforms. So, for example, you use it, and then people pay via PayPal or directly to the bank. There are different ways to
So
do
how
it.
do you do that? Do you pay first and then call the doctor? How does that work?
So it depends on the doctor, and everybody has their different policy. When
So
you
it's-
speak to
okay.
friends overseas, a lot of the time people pay first, be it via PayPal, the bank, and then because you know there's some people who try to get away with not paying. But at the end of the day, the doctors do have to make a living. But right now, during a pandemic, I will tell you, Laura, it is not the utmost thing in people's mind. Every doctor is thinking, how do we stop this thing? How do we save our country? How that is what is on every single doctor's mind right now.
So every patient needs to know their doctor and speak with their doctor as to
Yes.
what's the situation.
Absolutely.
You
So,
know,
of
so
course,
it's on a
this is
doctor per doctor basis.
So this is more for the private sector, obviously.
Yes, of course.
So there are two sets of patients because there'll be the patient who just woke up today with an earache that your GP may not know. I don't know you at all, and you're just calling. So you call the office. I need an appointment. We're looking at hypotheticals. I need an appointment. This is the situation. So you get an appointment, say at 1:30 in the afternoon. There are different apps. So you could use WhatsApp because WhatsApp is fairly secure. But there are apps specific to doctors. So there's Doxy.me. There's several of them that we've been speaking with our colleagues overseas and our colleagues here that can be used. So it's interface. So you're seeing the patient. You see the patient, medicine, 85 to 90% of the time, just the interview gives you the diagnosis. There are patients that need to be examined. So if I'm telling you, I've had fever, boy, you can't say fever nowadays.
Boy, I
I've had
tell you.
fever, my ear is hurting, there may be a discharge from my ear, that sort of thing. That may be an inner ear infection or middle ear infection. So that is a fairly easy diagnosis. So you can diagnose what we're trying to do, and I'll tell you where we're having some glitches and why perhaps a state of emergency, changes in legislation, giving the government sweeping powers, could allow to facilitate for those things. Because I think, for example, this person needs antibiotics. and this is just a hypothetical, I will call the pharmacy or I will write a prescription, take a picture, send to the pharmacy via email or via WhatsApp, so that person only has to make one trip, as opposed to coming to the doctor, leaving the doctor, going to the, you're just trying to limit traffic, get people off the buses, that sort of thing. So that's a new patient. So you would follow up with the, when all of this is over, you very well will follow up with this patient, because put it this way, you put somebody on antibiotics, you'll have to follow up with them generally. So you may think this person needs labs, so that could be done. Our labs are sending us our results via email, so that's not even an issue. It was being done before COVID, because it's 2020. It's 2020. You can't be having so much paper and files which are this thick. So we have that down. So you've seen the patient has explained to you what is going on with them. The only difference here, you may not get to examine that patient, as opposed to if the patient is sitting in front of you. But as I said, 85 to 90% of the time, the interview alone gives you the diagnosis. Now, if you feel doctors have instincts, and I mean, you train years and years and years to do this. This patient needs to come in. You do your triage. Okay, let me see what your fever was, because of course now we cannot pretend that COVID is not around.
Now, speaking of which, as you say, let me see what your temperature is like. I need to get a
Yes,
thermometer.
exactly. You need to get a thermometer.
I need to get a
You need to get
and
a
I think
thermometer.
every
It's advisable.
home should
Should
have.
have.
Oh, forget about the vitamin C. You're not going to get that.
Absolutely not.
No,
Long.
you're not going to get that.
Long time.
So let's just go back to basics and get our lemons and our
Yes.
lime and our
It's
citrus.
vitamin C.
It's vitamin C.
It's
Yep.
vitamin C. Yes. So you would tell that patient, okay, we may need you to come in on a certain day. You ensure that that person has that exposure, because of course we need to protect ourselves as well. Because if the doctors get sick, who is taking care of everybody else? So you're doing more triaging or triaging than you were doing before. Temperatures. Do you have a travel history? Anybody at home has a travel history? Have you been coughing? That sort of thing. That person is clear. You bring them in. You examine them, if there is a need for that. Otherwise, that can be done at a later date when this perhaps is over. So this is a patient you don't know at all. If a patient, for example, comes in with intense abdominal pain, that person probably needs to go to the emergency room anyway. This is not a patient you would want to be treating that way. Emergency room, get your ultrasound, get all of that done, get that sorted out. My chronic patient, the patient who I've been seeing for years, who has diabetes, hypertension, who I see every 3 to 6 months, who I know them very well, that patient is easy. And those are the patients that we want the most to keep out of the office, actually. Those that statistically we're saying are most vulnerable, are most susceptible to this. So they call you, the normal appointment that they would have had, they call you, you do the teleconference, the payment methods, as I said, vary. You do the teleconference. Of course, these are some of our older patients, so a relative very well may have to help them. What's going on with you? Is there anything different? Let me see your blood pressures, because we always ask patients, do your blood pressures at home, because that's important. And even though COVID is going on, we can't forget about that. Let's see what your blood pressures have been at home. Let's see what your blood sugars have been at home. Do I need to make any adjustments? If I need to do that, we do that, and we redo the prescription. So that is what we want to be able to do. So I don't want you coming in physically. Again, I'm not going to call the pharmacist with several meds. With one medication, fine. But if I have, say, 6 or 7, I want to do that prescription, take a picture of it, and be able to send it to the pharmacist. Now, the pharmacists in their regulations apparently were having issues with doing the WhatsApp and the email. They needed the hard copy. But as far as we are concerned, as a medical and dental association, of course, we have to work together. All of us have to work together. We are a team. We have to do this for St. Lucia. We don't want people touching paper right now. We don't want paper going through several hands and then getting to you.
Right.
We don't want the patient coming to us, coming to you, going to town.
Because
several
the
pharmacies.
virus still lives
Absolutely.
on. Right.
So we want to avoid that. So if we send it to you, so their legislation apparently was making it difficult for them to be able to do that. So we're hoping with this now, that would allow, give you the power, if the CMO says, fulfill those prescriptions, because of course their worry was, what if there are mistakes and that, but you have the copies just on the computer now.
Couldn't you fax though?
Most people don't have fax machines, Laura, anymore. I don't know
Email?
a single person, but email. So that was a problem.
Right.
So
Oh, email was still a
yes,
problem.
email was still a problem. So we're hoping now that the CMO has the authority to say, you know what, let's get this done, because we cannot have solutions on the streets. We cannot have solutions on the bus. I will tell you one of the issues we actually have with the state of emergency. We actually believe as a body that the curfew is actually too late, 11 p.m. It should be brought down. Maybe 6 p.m., maybe, because
Passation.
That is true. So that's a question. How do we cover Laura?
You know?
How do we cover my dialysis
Yeah,
patients?
yeah, yeah.
How do we cover? So
Yeah.
people always, how do we cover us? But
Yes.
we have ID. You expect the police officers, the doctors, but there are always people who are going to get caught in it because
Right.
that's why the dialysis patients say, I finished dialysis at 1 in the morning.
yeah.
I start dialysis at 4 in the morning.
Yeah,
so
yeah.
that
What's
sort of
happened?
thing.
Yeah.
But there are always going to be some
But
people
I
that we have
think
to make
there was some
exceptions for.
some provision for that where you could get this card that
Yes.
say, I needed to be out there
Absolutely.
at this time.
So we're doing that
Yeah.
for our patients.
So
And
yeah.
we're doing that for some of our patients because inadvertently they're going to be out
Mm-hmm.
at those times, our first shift and our last shift. So there are concessions that are going to have to be made, but we just all have to do it together.
Together.
We have to do it together, and that is why we support it. That's why
Right.
we absolutely support it. In fact, we'd called for it a week ago, as far as we're concerned as members. So the social distancing, and again, we had a graphic, Laura. I don't know if we could show it now
Let's
with
see.
reference to how this thing could spread if no action
Right, the
is taken.
power of social distancing.
The
Is this the
power of
one?
social
Okay, so
distancing.
let's see if we can get, because our graphics have not been going up, although I've been
Yes.
asking for it. The power of social distancing. Let's pull up this graphic where it shows one person
Yes,
and how,
what
how
can
many.
happen if
right.
you do nothing. So it's the new sexy phrase, not this one,
Not this one, but this
that
one
is dramatic.
Yes, that's a bit dramatic, right? And it's
True.
what you were just
Dramatic,
saying about
yes.
me with my hands, you know,
Yes.
alive with rough hands
Absolutely.
or dead with smooth hands.
What do you want?
So
Make
this
the
is
choice.
absolutely
That's
this is
what that
the
one is saying.
ultimate, yeah. But this is not the one we're looking for. We're looking for the one with the
Multiple
power of
little
social,
people.
with the multiple persons, one person, yeah.
Yeah.
So let's pull that up.
Yes. So essentially what that graphic, what that image shows is what we're doing now. Because if you have one patient and you do absolutely nothing, so you just live life, which in part is what happened because Italy, despite the fact that they had the China experience, they somewhat were still caught with their pants down, in addition to the fact people were escaping quarantine. And we'll talk about that. How important, how dangerous it is. And if anybody feels that they should be harboring somebody who's escaped quarantine because I love them, you don't love them and you don't love yourself.
So there we go.
So that is the image. So if you look at the top image, theoretically, if one person, symptomatic or otherwise, could potentially infect 2.5, each person infects potentially 2.5 people in 5 days if nothing is done. No social distancing, no hand washing, no cough etiquette, nothing. You infect in 5 days 5 people. Each of those 5 people now in 2.5 people could now infect 2.5 people, and so it grows exponentially. So by the time you get to a month, you have 406 people infected. Just imagine 406 people in St. Lucia having COVID-19. We have a major problem. If, however, you start doing some practices, and like I said, we've been very dramatic. We've gone way ahead of this thing because from the public health perspective, there are different actions at different times. So right now, we still have just imported cases as far as we know. So we could be more conservative, but we've decided absolutely not. We don't want to be conservative with this thing. We do not want to be caught with our pants down. If you just do some measures, in 5 days you have fewer people, but you still have quite a few. And in 30 days, you have 15 people infected. If, however, you perhaps do like St. Lucia, we get ahead of this thing, we do everything, we shut down schools, we shut down our borders, state of emergency, which allows us to deal with persons who want to escape quarantine. We are washing our hands, our children are washing their hands, we're coughing properly, we say home quarantine or quarantine at a public facility. This is where we're at. In 30 days, look at the number of people, way fewer compared to the 406, and that is what we're hoping for. Because the problem is, if we do not do this, in St. Lucia, if we look at the statistics in China, and we were over 300,000 patients globally right now, if we do not do this, too many people are going to get sick. And again, if you put up the graphic that everybody is seeing in terms of flattening the curve, you hear that a lot. That's another phrase we're hearing a lot, the flattening the curve. What does that mean? What the curve is, because with the image, when it comes up, there's a line. So there are two peaks or two curves with a line in between. The line, and it's important for St. Lucians to see what that graphic is. So essentially, yes, it's right up there now. So if you look at the red mountain, Tipito and Gopito almost. If you look at the red one, without protective measures, so the broken line is our healthcare system, or that could be the healthcare system of any country. If you don't take any measures, what you get is the red top.
Above the line.
Above the line. So that means your healthcare system cannot deal with it. People are dying unnecessarily. We have to decide, for example, Well, if you're 50, you're too old, you can't get a ventilator, you can't do anything, you die. Playing God, essentially. That's where Italy is at. So when
For people like me, especially.
for people who
Yeah.
with chronic illnesses,
Yeah.
but the people who get it bad and die. Because 80% of people are going to be okay. It's going to be a mild illness. But you know what's the danger of the 80%? They are asymptomatic, but they're spreading.
Correct.
And then when they're spreading to your granny, and to the person who's hypertensive, and to the person with cancer, the person with heart disease, then we have the major problem. So if we take the measures, for example, that we're taking now, we stay below the curve. So we could deal with it. So when we say flattening the curve, it means people are going to get infected. What happens, though, is instead of 1,000 people infected at any given time, overwhelming the system, you may have 20 people infected. You could deal with that. Your doctors aren't burnt out. More people aren't getting infected. People are getting ventilators if they need it, God forbid. And that is essentially what this flattening the curve is. So we just need to prolong this thing. And the other thing with prolonging is that we build another phrase that people have herd immunity. Right now, we are completely naive to this thing. It's kind of like, if you remember, I don't know if you got chikungunya, I got it. That killed people in terms of your
Yes,
jaw.
some people are still suffering
Still
from that.
suffering from
Yeah.
it. And we were completely naive. Our population had not seen it, whereas in some countries on the African continent, chikungunya comes every year, it goes, and it's not going to do that sort of thing. Right now, people are getting chikungunya, it's just not doing what it did that first time. Same thing with Zika. When the population is naive to something, the impact is significantly greater. And that is what is going on right now with COVID.
If we can get to that if we can get to that video where that clip where we have the rate at which persons are increasing, you know, per country, I think it will even highlight what you're saying because it's a new, it's something new.
It's new,
And
yes.
you don't know what to do with it.
Everybody's getting it. There's no
Right. So if we
information,
can
no
get to the
vaccine.
COVID-19 infection rate, we can
Okay.
that will highlight some of what you're saying as well.
Right. So it is important that every citizen recognizes, I think, and again, yesterday I sent out a voice note to the media houses, and in it we were saying, stay home. And we kept saying, stay home, because it's important. And people could take it for granted, but it really, really is. If there ever was a time you could do something to save your country, like you literally could be saving your country by staying home. Because when you do not, and you go to the bars, it's not a question of just you, it's a public health issue. Whereas, Laura, if you decide, oh, well, I don't care, and I'm going to drink how I want and do whatever I want and mash up my liver, that's on you and perhaps your family, your finances and that sort of thing. If you need a liver transplant, which you're probably not going to get, but that's an individual and perhaps a family. With this, when one person gets it, you could spread it to multiple people. And that is why it's a major public health issue, and it's not just about you. So that is why when we say you need to do this for your country, we all need to do it for our country. That is what we mean. So staying inside may seem simple. Staying inside may be trivial, but it is important that we all stay inside. There's some of us who cannot stay. And I mean, what's trending for doctors is, I stay home, I go to work for you, now you stay home for me.
Yes.
And it's important, and it's real, because we have to go. We have no choice but to go. But we need everybody else who is not essential to stay home. And I think here we want to make an appeal to, your bosses, your supervisors, that if it's not absolutely essential, if the person can do, if it's paperwork or something that could be done on a computer, let them do it at home, especially if they don't have private transport, because that's another factor that's important in terms of going to the doctor or not going to the doctor's office. If the person has private transportation, that makes your life a little easier. Take your car from home, you come to the office, we do your business, you go home. However, if that person has to take the bus, and sometimes 2 buses, you want to avoid that, because again, the distance, you're in the bus, we sort of breathing the same air, there's not much distance on the buses, so we want to avoid that as much as possible. And the truth is, we're all going to take a hit. The bus drivers are going to take a hit. Everybody, there's going to be an economic impact. But if at the end of this, we do this for 2 weeks, we get whoever may have already been infected, we deal with that, and then we could assess and decide what we want to do after that. But if we do not, it's just going to keep growing exponentially. Just like we were saying before we got our first case, it's not a question of if, it was a question of when.
When.
If we don't do anything and take those extreme measures, it will be a question of how bad is it going to get? How many of us are going to die? And that is what we're trying to prevent. So it's not a question of doctors being afraid or hiding or anything to that effect. It's a question of us knowing that we need to be prepared. Some of us may need to go do some hours at the polyclinic or at the health center, because as you know, with the over 100 people at the new quarantine facility, the district medical officers are having to handle that as well. So in addition to their usual polyclinic work, health center work, they have to be seeing the patients there.
And we have 5 areas, 5.
Yes.
Let's just highlight them a little, because I think not enough of us know
Know that,
because I
yes.
get persons asking me, we're not getting enough information.
Yes,
So,
yes.
like for instance, in Labyrinth. And that's the other thing. Some of this information we really should be saying it in patois, because a lot of
Savu,
yeah.
you are correct. I think we failed in that
Yes,
regard as
yes,
well.
because
Yes.
we do know that there are some people who understand better
Yes,
in Creole, so
yes.
we have to try to be cognizant of that.
Yes.
But persons are telling me, health center ferme in
Yes,
Labrie,
yes.
health center ferme. So
Where do I go?
Where do I go? Like,
do I
what
go?
do I do? You know.
All right.
And they're asking the question, and I'm saying, well, there are the 5 areas,
Yes.
and they say, no, only put money, chest
Yes.
your sass, if I put but I'm saying, I am giving you the information
Yes.
that I've already asked the question, and the information has been made of late ton from
Yes.
the doctor. So
Right.
tell the people.
What's going on?
Right.
Firstly, nous supposons hand phone. So ministry c'est telecoms company have a ministry phone, you can buy doctor qui have volunteer qui can hand 311. So a lot number moi kwa katwa via chama lo qui 311 ou ka hand guidance la bouze pour sa côté on y pour aller based on qui ça on y. Mais nous ka parler avec Dr. Belma, il ka porter ses phone because right now office nous fermé because nous ka practice what nous ça nous ka preach et office nous fermé because nous ça travaille from home. Unless nous ne pouvons aller under office là, office SLMDA. So, nous ne pouvons avec Dr. Belma pour y bailler ces différents docteurs, là, nous ne ces guidelines là, qui ça nous ne pour faire avec ces phones. So, pour exemple.
So if we can put up the graphic protocol number 8, then at least the viewers can see the number on the screen.
Yeah.
Okay, so that's COVID-19 protocol number 8. Let's see. Let's
Yeah.
put that up so that persons can see.
Easy to remember enough. But like I said, in addition to 311, we physicians will be manning those cell phones, so the numbers and all of that will be made available.
So like I need
to
doctor
citizens.
as lot side the
lot side
telephone
phone
na
na,
pour
oui.
weapon pour do kisa pour
Because
faire.
nous also recommend 311, là ni pour ni docteur tout.
Oui.
Pour ka di moun exactly ça pour faire. Because ça nous brise, Laura, c'est puis si ou just ni anti la fièvre, ou pas ni shortness of breath, ou ça reste la caillou. Ou ça reste la caillou, c'est ça nous veut ka di moun. So it's just ça nous tout niveau ka di même message là. Yo docteur labo oui pas supposé ka di yo bagay, et docteur gozi le ka di l'autre bagay. So nous tout veut di même bagay là. Because là ni 6 center qui a ouvert, respiratory centers nous ka créé yo, of flu clinics. Ça c'est Grosley Polyclinic, section C, là ni a section polyclinic là qui pour ça, et a section polyclinic là qui normal. Le Clary Health Center, Denry Hospital, Soufre Hospital et puis Viewfort. Now là still ni change because bagay ça là ka move vite a chay. So là still ni changement, pour exemple, nous te capable avec ministry a hodia, là ni de trois problèmes vieux fort. So y avait mis un tent pour yo ça triage c'est mon bien. Et là nous dit triage, c'est ouais qui laisse qui pi technique COVID. Qui laisse un moun vini from l'Angleterre. Et yo moun ça ka toussé actuellement avec c'est bail ça. So nous pas ka mix moun. Because peut-être qu'il fait, mais ou veille fait minimum et pour nous pas ka ni patients ka infect l'autre. So l'année de trois changements et peut-être un south là, yo jusqu'à acheter l'autre health center peut-être plus petit que yo ça fait flou clinique là et l'autre health center ka fait c'est normal bagay là.
Bon, question pour les health center qui fait flou clinique avec bail quoi. Les autres services
Yes.
qui health center can provide. For instance, you have prenatal,
Oui, oui.
right? Ou ben on y un jour les grand monde qui vient
Oui.
le health center. Qui ça qui arrive?
So c'est pour ça que cadeau nous besoin séparer. So Grosley Polyclinic easy. Là ni différentes sections.
Oui.
So your section. So pas toutes ces health center qui comme ça. Then you had try c'est DMO had try improvise et you ka séparer pour l'autre monde sont différents docteurs. Ka wè lot se moun ak yo docteur qui ni protection ni ak tout bagay ka deal ak flu clinic là. So c'est ça nous veut faire tout health center pour ça moi te cadeau. Peut-être vieux fort yo veut faire une différente place pour flu clinic là et quitter health center vieux fort pour normal c'est bail ça. Now même si moi dit ça, nous still vle moun si on ni pressure sick ou docteur just l'autre jour ou ka check pressure at home et OK, parler pour actuellement let tout ça fini. Nous kaidu ou sa vie health center because nous pas vle moun infecté.
We need a call. Hello, good evening. You're on the air. Thank you for calling. Okay, I think we're having a little technical difficulty. We'll go for a quick break, and when we come back, we'll start taking calls. I'm so sorry to the person who is on the phone. Let us let's go to break, and then when we come back, we'll take calls. Staying tuned with us. We have a call online. Thank you for calling. You're on the air. Hello. Hello, good evening. You're on the air. Okay, the call has dropped. Okay, so let's continue, Doc.
Nou te ka di kose klinik la
Oui.
ye. So, so sa nou ka di nou ka try in as much as possible pou sepawe se patient la ki pa ni COVID ou nou pa kwe ki ni COVID ek se patient la ki normally ka ale. Men nou still ve...
We have a call online. Thank you for calling. You're on the air.
Yeah, good evening, Laura.
Good evening.
And good evening, Dr. Clark.
Good evening.
Laura, this program is so good tonight. I'm not saying it's good tonight alone because you have had a lot of very good programs. But tonight, it is so informative, Laura.
Thank you.
After you're getting everything clear, apart from the people that turn experts overnight, giving the idea and everything. Dr. Clark is so precise tonight. Like Dr. Clark is taking everybody through the ropes and telling us what to do and how to do what. And I was just about calling and tell you to ask Dr. Clark to at least say some of the things in Creole.
Yes.
And I heard you mention it to her. And like Laura, I am telling you, Dr. Clark, I will tell you to you and your team and Madam Belma, God will give you all the strength, the courage, and the insight that you all can perform to do what you all need to be done. And the other thing, you said something there tonight about the curfew should be at least looked into again, because that 11 o'clock thing does not work. If we want something serious, we have, and I believe the doctors have the authority to tell the government, because you all are the experts. You all know what is what.
Yeah.
And the
I think they've been
curfew, I
listening and we
believe
believe that.
the curfew should be 8 o'clock, and the people that are working, I believe that the boss, right now there is no such work going on in the island right now. The boss should allow the staff to go at least latest, because nobody is doing nothing. So therefore, the people that want to go to the supermarket, let them go from 7 in the morning to 4 in the afternoon, and let the staff go home, that the government can impose the curfew, that we can be safe. Dr. Clark, you all are doing a marvelous job, and thank God for you guys, and God will give you all the strength, as I say, and the courage. Just stay blessed, and God is with you guys.
Thank you.
Thank you so much, caller. Thank you for calling. Yes, so e pota puno because su kapale Espanol ek simuna kapale Anglo pa ikopone.
Sabi.
We have another call online. Thank you for calling. You're on the air.
Good night.
Good night.
I want to ask a question.
Go ahead, ma'am.
So if, let's say, you have the COVID-19 virus, how do you know that you're cured?
How do you know that you are cured? If you have COVID-19, you've quarantined and all of that, how do you know that you are cured? Thank you for your question, ma'am. Please listen on air for the answer.
Just now, I have one more question.
Yes, go ahead and ask.
The persons that were tested positive with the COVID-19 virus, the two first persons, are they still on island?
Okay, so we'll answer that. Just listen for the answers on air. So you have two questions. One is, how do you know that you are cured? And the other, are the COVID patients still on island?
Yes.
Thank you so much.
Welcome.
Now, many viral illnesses or illnesses caused by a virus don't have a cure as such. In essence, the virus is going to run its course for the most part, and then you get better. So COVID, for the most part, the treatment is symptomatic, just like the flu. There's hardly anything specific, apart from the fact that COVID is new and we just don't know. So, ek ou jwenni, peut-être 2 jours après, ou ha ka tousse tout, on la fièvre, gorge ka fè mal, ou ka senti mal. Ek COVID, ou sa jwenni, ek 14 jours après, ou pa sa ka senti, ek sa se problem.
We have another call online. Thank you for calling. You're on the air.
Hello, good night.
Good night.
Yes. What a blessing, eh? Pour nous explain, pour nous simpliciter, qui ça qui proper, et pour nous pouvoir stay home. But I thank God for the knowledge He gave the doctors in St. Lucia to cope with that and to instruct us. And it's not only washing the hands, but say personal hygiene. C'est tout bagay pop, tout kay pop, tout towel pop. C'est pas only laver les mains. De gwa moun nearby ka di, de le nou laver les mains si à terre. Mais c'est pas only laver les mains. Et chaque home ni pour faire papier. Et si yo di pour quarantine, anou est-ce que la kay nou? Anou sanitize home nou, toilet là, sink là, tout dehors, tout partout. So, moi n'y a problème avec only laver les mains. C'est pas only laver les mains.
Non, mais nous pas dit on li laver les mains. Nous ka dit toutes ces bagages ça là. Ou absolutely right. On y peut nettoyer table avec désinfectant, nettoyer faune, nettoyer linnet tout.
Mais sanitize tout côté.
Oui, ou absolutely correct.
Tout bagay. So that nous savons, là nous ka sorti, nous ni pour ni hand sanitizer non. Ou comprendre? Moi-même, les moi sorti, pas même trolley en ces shop là n'a servi.
Right.
Because trolley même c'est un bagay ou pas aimer ça. So we have to avoid that. And thank God for St. Lucia that we know cleanliness and we're trying. We're trying our best.
We are
Thank
trying.
you.
Thank you so much for calling. Thank you.
So with reference to the person's question about
Mm-hmm.
curing, so what is happening and what we need to be doing, so somebody comes in, so the two of the three have left, because one was a national, two of the others have gone back.
All right. So the first two have left,
Have-
but the
they
third
left
one
today,
is still.
yes. It's a call.
We have a call? Thank you for calling. You're on the air.
Good night, Doctor.
Good night.
And good
Welcome
night,
to Dalhair Broadcasting Service.
Mrs.
I'm sorry we are not.
Okay, I'm so sorry. We had some issues here.
Yes.
Right. So, so we're saying that c'est the premier day patient la usually.
Yo ale, yo te suppose ale hot ya, mwen kwa yo ale, me lot la sa local e ki la kaili.
Okay.
Because sa lot bay moun ka made shy question, pou ki sa de moun sa la kayo, pou ki sa de moun ni po ya quarantine. Sou ni facilities la kayo, ou ni apartment pitet, ou ni on previtu, ou sa fe on maje ou, e kou kayo be responsible ek pakite kayo, yo sa quarantine ou la kayo. Même si ou ni COVID. So même si ou ni COVID, mais ou pas contact pièce l'autre moun, ek ou pas malade, ou pas breathe fort, ek ou pas sa breathe se bay sa, ou pas ni pneumonia, ou sa reste la kayo. So sa yo kay fe, yo test ou positive. Après un certain temps, ek se protocols la, yo still ka travaye la, kita yo kay test ou ako. Mais yo kay test ou ako, pour make sure sa negative, ek then ou sa la kayo.
Est-ce c'est autorité ka aller en commune ek
Oui.
fait asiwe moun sa self isolate ou sa self quarantine.
Ek se part of problem la yo ten yek Martinique. So yo ka fe sa, yo sa fe sa, me environmental health, mais yo pa sa fe sa bay tout moun. So le 90 moun se vini Martinique, impossible pou ay we kay sa pou kay tout moun, so se pou sa yo te porte yo a quarantine facility ya. Now la ni a de question nou di pou made yo, because mwen konet an nos la, ek I ni on kay li kay weste, ek nos la kay quarantine koy, ek I still la. So mwen buze made yo, pou kwa mwen, si pa sa la kayo, because mwen kwe, pitet isa le si kay weste la kayo li, me nou ha weste problem lek ada moun ki pa ka weste, ek sa biye de jewe. Le nou tan moun ka atwe sot Martinique denri, sa biye de jewe. Sa buze stop, because sa kay pitet afekte nou tout. So moun denri, nou buze yo kopon, si ou sa va moun ka soti Martinique, because Martinique ni a shy case, ek Martinique a ferme borders yo, lo ki te moun nan vin la kay, si se issue, ek ou ki te vin yo, ek ou pa report li pou yo quarantine ni, ek ou pa ni pias kote la kay yo, o tout kay malade si ni COVID.
Ek yo tout kay ni pou al quarantine, parce que yo pas sa wese la kayo.
Exactly, so pas wese la kayo. O pitet si telman moun an de pias kote yo set lisi, ek ou ka wese a ka fete Italy, yo ava Italy te shut down completely, yo ferme a de kote ou pas sa sorti,
Oui.
pitet ko ka weste alor, piason ka pas sa
Right.
sorti la bo oui, et puis ek ou tout ni pou weste la pou 14 jou. So y vote
Et qui manière nous kay fait moun, because quand en place qu'on la boui, là ni tellement différent manière pour sortir la boui, là li boss là ni
Yes.
vieille là ni là ni toute manière différent tout pour aller.
Yeah.
Et nous là ni moun qui just ka point bateau yo, because nous savent là ni moun qui ka point bateau yo, ka aller Martinique porter moun viwe cette
Oui.
liste nous vle moun ko point kek yo ni pour doubout ça,
Oui.
because ça pas
Ça
ka
danger,
fait
oui.
oui ça
Ça
danger
danger, oui.
ça pas ka fait rien bon pour vous. Même si vous payez $600 bon,
Exactly.
$1,000
$1,000 ek ou mo.
ek ou mo.
What's the point? C'est because c'est pour ça, in part, ça fait Italie, commence à faire bagay ta. So même ça nous a fait, à fermer borders là, avec ça. Yo commence à faire ces bagay ça ta, et aussi moun te ka escape quarantine, en chay, et c'est pour ça yo ko yo l'automne 700 moun mo odia. So en
Under
chay
yon
moun
jou.
under yon jou. En chay moun ka mo Italie. Yo ka di pitet la ni chay moun ki elderly, moun ki pli vie tout, mais just because ou vie, la ni tibe moun bien ki ka marche la vie la fait tout ba yo pa
Oui,
koyo.
oui.
Ça pas mentir ça mo, so ça ka fait. So et important cette liste nous tout point responsabilité pour protéger pays nous, pour protéger yon a l'autre, pour protéger ces moun famille nous, et las fait bagay bout ça là because c'est pas rien de personne.
Yon moun made mwen as WhatsApp. Est la ni un mot en créole ek ne avoué toto mwen essaye kakoute because it's not Dr. Creole pour ça di mwen
Asi we not essay. Essay Asiwe pal. Get it right. Get it right.
Oui, moi asiwe ikakoute, bon Dieu kay haye moi pour ça because moi supposé connaître plus mais moi asiwe ikakoute ek moi vle di moi est la ni un mot en créole pour social distancing.
C'est ma quoi c'est yon mot qui dit on est
Eh
pour
bon,
rester loin.
en phrase pour ces moun ça comprend social distancing.
How
We
est
have,
pour moun?
we have a call online. Thank you for calling. You're on the air.
Hello, I understand that if your prescription has gone out of date, you can still get your medicine. But are there pharmacy coming up to the health centers?
So the pharmacist did have a press release
Thank
today,
you.
as we said.
Thank you for calling. Is that all the questions you have?
Yes.
Okay, thank you. Listen for the answer on air, please.
We had been having some issues, but they're coming around. So I think Clark Pharmacy, for example, you can send it via WhatsApp ahead of time, and then you go pick up. So, but you take a picture of the prescription, you send it to them. So 10,000 people aren't waiting in a line. I think we're going to get there in terms of being able to send it via email, because we can call a pharmacist, for example, and say, but that's just for one medication. When you have multiple, you don't want to be doing that. But I think they're coming around, hopefully with the new things that have been put in place. Nou kay hen yo pou sa fè se prescription na pou moun pani pou vini a office la pou a prescription na. Me yo voy a press release so dia ki ka di si ou ha le file yo e kou bwize pitet ni pressure si ke yo kay ba yon mwa mwimed la si yo pasaj yo en dokter. Me yo ka kuye nou ka kuye nou ek nou kay wok sa because nou tout sa pou set lisi pou protéger set lisi pou asiwe se after this mensa nous tout ka ici à toujours.
I like that because I know that it's especially, and I think MNC does it as well.
Yeah.
But they have you on system, so when you come, they ask you,
Yes.
you know.
Yeah.
Because sometimes, you know, I forget my prescription.
It's not something you want to encourage
You
all the time.
But for
these are
this
special
particular
times, yes.
situation,
The extra
they know you. They
Yes.
know you come in all the time, and they can see, okay, and they have on record
Yes.
how many times that this prescription
Absolutely.
is supposed to be filled. The tricky thing about it is if you fill your prescription at different pharmacies.
Yeah.
So you filled it twice at MNC,
Yes.
3 times at Clark's, once at, and you're only supposed to fill it out 6 times.
But you see, the pharmacists, so with the physical prescription, they can stamp it.
Right.
And the truth is, I'd say, Laura, so you hear in the U.S. a lot about the, opioid crisis, and that thankfully in St. Lucia, we don't have those issues. And one thing the pharmacists do say, and they're clear about it, generally we can't call in controlled substances.
Right.
So it's usually your medication for your diabetes,
Your
and
hypertension,
your
cholesterol.
lupus, that sort of thing, exactly.
Right.
And we don't get that problem happening a lot.
Right. Before you continue, a WhatsApper is asking to make a special appeal.
WhatsApper?
A WhatsApper. To the men,
Yes.
because despite the 14-day isolation or self-quarantine or self-isolation that we're asking for, they still congregate in their
Yes.
favorite watering
Yes.
holes. And those are grown men, not just
Yes.
kids now we're talking about, because kids will be
Grown
kids, and we're trying to make a special appeal to them as well. But the men, and they stay... They come to and they're not 6 feet away.
Right.
So they're,
It's
on the
impossible.
block. Right. The block is not 6 feet long.
It's not. Men, you need to stop. Let's just say, and it's not only are more men becoming infected, over 60% of the cases, but more men are dying. Way more than women. So stay away from the bar. 2 weeks, you can do it. Stay away from the bars for now. In fact, the bars should be closed.
Not just the bars, because this one is, the person who's asking is not about the bars. They're asking, like, you know, on the block, like
No,
just
stay
a regular, you know, like they have men who go play dominoes
Yeah.
by the beach or whatever. They're still going there.
Yeah.
They're still doing those things.
You'll play dominoes after. You need to be alive to be able to play dominoes. And this is not about panic. This is about reality. We all need to do this for St. Lucia. And as we said, what is being observed, they're not quite sure why. If it's because men smoke more, if it's because men don't see their doctors as much, and they probably have underlying problems. But men are dying at higher rates in this pandemic than women are.
We have another call online. Thank you for calling. You're our final caller for this evening.
Oui, bonsoir Laura.
Bonsoir.
Social distancing, ça veut dire ou supposé combler.
West
Ou pas supposé combler.
Oh, pas supposé combler. And moi, just ni a lot monde dit moi, c'est pour chain distance sociale. right?
Oui, so pas supposé combler ou pas supposé change distance.
Right.
Combler ça
Right.
veut dire ou ka rester en distance votre monde.
Right.
Merci en pile.
So pas bon moun ou pas hug moun. C'est pour ça juste le message actuellement moun ka fait le message. So you ka fait telling le message. Même ça nous
Oui,
fait medicine là.
oui.
So bagay ni pour changer. Nous ni pour faire bagay différent. Moi just vais dire avant nous end because moi nous ka aide Laura that tout côté la terre, ça ka ouais PPE, c'est protective equipment pour
Yes,
docteur.
yes.
Ou ka ouais ça ka fini ek nous ni SLC mais nous ça nous fait faire because nous c'est SLMDA, nous c'est a professional body mais nous c'est trade union bargaining agent pour members nous. Ek nous ka nous pas members nous ka travailler ça. So nous ni pour protéger kono because si nous pas protéger kono ek nous malade nous pas ka ça pour que personne. So ça important. Ek ministry a dit nous, hodi a nous tenir meeting, yo ka ensure yo ni PPE a toutes ces respiratory centers là, c'est sec là nous tenir. Nous ka ni se phone natale, 311 si vous travail pour bay cette ici plus guidance côté pour aller sous malade, mais try in as much as possible pour couiller avant. Couiller moun, couiller docteur, couiller nous ka dou ça pour faire, nous pas ve moun ka marcher à chimère cette ici pour actuellement. Cette ici important nous faire ça pour nous tout ici après pour nous ça célébrer et manger et faire tout ça nous veut faire.
Des bagages moi te voulais parler about avec nous pas ni temps.
Ça pas la chaîne.
Ça parler. C'est containment versus mitigation and isolation versus quarantine. So you know what's going to happen. I'm going to have you on, maybe not next week because I want to have another show planned for next week, but maybe the following week, God willing, because pas jamais fin ça kay fait. Bon Dieu vle, nous kay ni a lot show ko kay focus as
nous kay côté Dr. Belmar because you say public health pour nous.
Right.
Qui connaît c'est by ça please
containment and mitigation and isolation versus quarantine, because those terms they are rampant in our lexicon right now and we're hearing people talk about it but we don't know the difference. You know, the layperson does not know the difference. And as we can see, the graphic on how rapid this thing has been increasing for different countries, and we do not want that to be us
at all.
We do not want that to be us at all.
We're resilient, but we need to do something. You know,
Avant d'ouvrir
and all of that.
Yes. And we're out of time, but you know, any final words that you want to leave with our viewers?
It's very simple. Stay home. There's a reason we're saying it. Wash your hands, cover your cough, protect each other, love each other. Don't lose your humanity. Stay home, stay home, stay home. Bosses, supervisors, let people be home if they don't need to be at the office. That is the only way we're all going to survive this. The economic impact is going to be there no matter what. Every country around the world is going to feel it, but we need to be alive to rebuild this country after this. If we're all dead, there's no country, there's no us to rebuild it. So that's why we believe we need to stay home. There's a reason those measures have been put in place. The authorities have done their part in a sense. There's more to be done because NIC hasn't made a statement, and that is important for us physicians because everybody is calling for sick leave when they have to be quarantined. So those things certainly do have to be put in place and very quickly. But from our end, we encourage you. We know why we're saying it. Stay home.
And one other thing that we didn't touch on, the indigents and the homeless. What happens when this thing finally breaks out, when we have this, because it's inevitable, yes. So we're going to have to touch on that the next time you're around or Dr. Belmar is around. So we're making notes, right, Dr. Clark, of these three things. We need to talk about the homeless and the indigent. We need to talk about mitigation versus containment, and we need to talk about isolation versus quarantine. In closing, as the coronavirus spreads around the world at an ever-increasing rate, only 3 cases have been confirmed in St. Lucia. Just 3. A drop in the ocean compared to Europe, where Italy alone has currently over 12,000 confirmed cases. But there are concerns that a wider outbreak here could overwhelm the less than stellar healthcare system that and our already fragile economy. And we saw what that situation could be if we do not contain and flatten the curve in a hurry. Authorities here in St. Lucia fear that St. Lucia is especially vulnerable to an undetected spread of the virus, and as such has declared a state of emergency. But what about the ensuing economic backlash? absolute power begets, or absolute power corrupts absolutely. And that is a fear, a very real fear for a number of us St. Lucians. Not in a malicious way. We just need to be sure that when there is a state of emergency, when certain persons have carte blanche power to do anything, it is for the good of our country. Stay tuned for next week for a dissertation on the economic fallout of COVID-19. But before we close, and I know that I said in closing, one more thing, we did not talk about OKEU and the expedition of
so
moving
we're moving
in.
to OKU. So we just want St. Lucians to listen to your radios, your TV, your text messages, because there'll be a lot coming out in terms of the changes, what will be required of us. They're changing in visiting hours. So tout moun pa ka isa visit. You can limit large to less than 10 or pli 60 ou pasay we moun na, pli de moun pasay we moun l'hôpital. So ça nous ka try faire c'est reduce traffic pour nous ça move tout moun a lot l'hôpital la vite, mais koute radio, koute NTN, koute toutes ces stations garder news pour savoir qui ça qui a fait. So ou ça le nous ka faire move là ou pas hinder ça à pièce manière.
So ça c'est 4 sujets nous pour parler. Oui, ça c'est 4. Bon, ça c'est a whole show encore. So nous pour parler about mitigation versus containment, quarantine versus isolation, the indigent and the homeless, and OKEU
And
moving
testing
into OKEU. And that is it. I mean, we're over time, and I wish we had 2 hours actually, but then police guy no because nous kay ville après 11 nous kay sushime après 11 and we know that there is a state of emergency. There's a what's the phrase I'm looking for?
Curfew.
Right, curfew from 11 to 5, and so we need to be out of here. But people, stay tuned to DBS, stay tuned to our various talk shows, because we will be bringing you very real information in a very real way. Nous parlons créole, nous parlons anglais, nous casser, nous porter descend pour ça comprendre. Right, nous faire adam manière pour ça comprendre. Just pas go mode. We don't have to break it down. We broke it down for you so that you can understand and get the salient information. Please, please, please. If you do not need to be out there, stay home. Even if you're a loving person and you want to hug your friends, if you're staying home and you're in isolation, then social distancing becomes a breeze. We would rather be alive, alone, than to be dead with so many people crying over our demise, and they can't even come to our funeral, and then they're dying shortly after us. So please stay home, stay safe, take care of yourself and of each other. Until next week, adieu.
What happens now? You'll get